Good afternoon. I'm Dr. Jas Atwal, Acting Deputy Chief Provincial Public Health Officer for Manitoba. Today, we are announcing 2 additional deaths due to COVID-19, both from the Winnipeg Health Region. I want to extend my condolences to all the families, friends, and caregivers of these individuals announced today. The current 5-day COVID-19 test positivity rate for Manitoba is 5.7% and 4.2% in Winnipeg. As of 9:30 a.m. today, 92 new cases of the virus have been identified in Manitoba. The total number of lab-confirmed cases in Manitoba is 31,235. There was 1 death removed, as it was determined after further investigation that the death was not due to COVID-19. This was a male in his 70s from the Interlake East Regional Health Authority. It was originally announced on December 11th, 2020. This brings to total number of deaths of COVID-19 in Manitoba to 879. Additionally, we are announcing that 3 confirmed cases to be the result of B117 COVID-19 variant have been detected in Manitoba. This is the variant first identified in the United Kingdom. This brings the total number of variant of concern cases in Manitoba to 4. All 3 cases have recovered and have completed their self-isolation requirements. The number of contacts for the cases range from 4 to 24. I also want to note that these are not connected at all to First Nations communities. There is no evidence of further spread in Manitoba related to the variant. This is not an unexpected development. We are anticipating variant of concern cases in Manitoba, and we are prepared for this. This also illustrates why we've enacted stronger travel self-isolation requirements and continue to tell Manitobans not to travel unless they absolutely have to. We are also doing aggressive case and contact management with VOC cases and contacts. There is no cause for immediate public concern. A note regarding our variant of concern case reporting. We have provided a high level of detail regarding these first variant of concern cases. However, this is not sustainable going forward. After today, the number of cases will be provided in the bulletin, and we are looking at providing this on an online format as well. Just like our first cases of COVID-19, we need to learn to live with the virus and the variants of concern. However, that does not mean we can become complacent with our actions. These cases serve as a reminder to continue to follow the public health orders, advice, and messaging. To continue moving forward and slowly reopening and to prevent the spread of variants of concern, the fundamentals still apply. You need to stay home when you're sick. You need to wear a mask, wash your hands, cough into your elbow. You need to stay home and self-isolate if you're waiting for test results. If you or someone in your household is waiting for test results, your entire household should self-isolate. We have to keep focusing on those public health fundamentals to make sure we can continue the reopening process and not have to take any steps backwards. I'm hearing from public health nurses that people continue to have visitors over while waiting for their test results. If you're waiting for a COVID-19 test result, it is critical that you, and along with your household, self-isolate when showing symptoms or when waiting for a test result. You need to avoid contact with other people. You need to stay at home, not go out. Do not have visitors over at your home. You need to practice the fundamentals. Avoid sharing household and personal items. Have essential items delivered to your home, and only leave your home if you need emergent or urgent medical care. Following these important steps to properly self-isolate will help prevent the spread of COVID-19 to others in your home and your community. I'm also hearing that people don't consider a sore throat or a loss of taste or smell to be a significant COVID-19 symptom that warrants testing. That is not the case. They are symptoms and do warrant going for testing. They might be mild, but they are still symptoms. To review symptoms of COVID-19, they include fevers, chills, cough, sore throat, hoarse voice, difficulty breathing, loss of taste or smell, vomiting or diarrhea for more than 24 hours, a runny nose, muscle aches, fatigue, pink eye or conjunctivitis, headache, skin rash of unknown cause, poor feeding in an infant, nausea or loss of appetite. You should still be tested even if symptoms are mild or if they start to improve after 24 hours. Take the online screening tool if you develop any symptoms. It is important to get tested as soon as symptoms appear, as tracing and isolating contacts in a timely manner is important in limiting the spread of COVID-19 in our communities. Testing site information, location, and hours of operation are all listed online. Wanted to provide a little bit of clarity on photography and videography services. Under the current public health orders, photographers and videographers can offer services to one individual at a time at either a retail location, such as a studio, or a registered home business. They can provide photography or videography services at weddings or funerals. Photographers and videographers can also offer outdoor services for households under the 5-person outdoor gathering limit rule. We apologize for the confusion and have updated our website to be clear. I can now take questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question today. Up first this afternoon from CJOB, Will.
Good afternoon, Doctor. Wondering if you can give us a few more details about the new cases of the B117 variant of the virus you mentioned just a moment ago. Can you tell us where those cases were and when the individuals were tested, please?
Yeah, so we're not going to get into so much detail here on testing dates, et cetera. I mean, these are cases that have all been related to travel. They tested positive, sequencing was done. They did exactly what public health asked them to do from a case and contact perspective. And I think that's how we're going to be continuing on with that information as well. It's too burdensome to talk about each case individually. There's some privacy concerns there as well. At the present time, all of the cases have recovered, though.
Okay, thanks. And shifting gears, we're getting questions from some parents who are upset they can't send their kids to things like skating lessons or gymnastics together. They can only be one-on-one with an instructor. So what exactly is the benefit of breaking up a group situation like this when the majority of the individuals live together anyways? Yeah,
that's a great question. This comes into how we're trying to open up businesses and sectors and get people back into those activities. We wanted to let things open up, but we also want to be cognizant of the number of interactions were occurring. So, orders are broad strokes, broad brush strokes. We wanted that one-on-one activity to happen, and I think that's where, the orders came to be. We understand that it does impact some families, especially with siblings, if they're, at the same age or similar ages, they're able to do something together. And that's something that we could continue to look at for the next set of orders as well. But at this point, the thought was to limit the number of interactions between individuals.
From the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Sun. Just so I don't misunderstand what you meant by it, can you speak? Now, you talked about how with these new variants we have to, I don't want to say learn to live with it because I don't want to mischaracterize what your comment was. For people who have concerns about these new variants, what would your message be to them?
Fundamentals still apply. We have variants in Manitoba. We have 4 variants of concern that have been identified. That was all related to travel. We keep messaging people, don't travel unless it's essential. If you do travel, follow those orders and guidelines that are provided. For people that are concerned, it's the fundamentals that are important. You want to limit those interactions, only go out for essential reasons. If you're sick, go get tested. Avoid travel, period, unless, again, you have to have that happen. We've been fortunate in Manitoba up to this point that we haven't had any community transmission of variants of concern. We haven't found that. We need to continue to be vigilant so that Manitoba doesn't, have community spread of variants of concern as well. We put in measures in place from a public health perspective. We have lots of testing sites open. We're looking at screening samples. We look at genetic sequencing. Our case and contact management is aggressive with variants of concern as well. So I think on the public health side, on the testing side, on the messaging side, it's strong. I think on the individual side, people need to adhere. People need to adhere to the orders and the messaging, and I think that should limit, concerns related to the variant of concern as well.
You mentioned the public health nurses speaking about people who are supposed to or should be in isolation, having visitors over. Is the message that maybe people are starting to want to get their eye off the ball in terms of, we saw this months ago when people started, I don't want to say get tired of the restrictions, but they started to be a little less vigilant. Is that kind of the message that you're raising with your concern with that?
Yeah, there likely is some complacency there. Again, we want to protect Manitobans. We're very clear on when one should self-isolate. I mean, again, in this situation here, these are people who went for testing and had people over. They probably knew that they shouldn't have people over at that point either. So again, that adds into the risk, because once one person tests positive, all of a sudden we have a whole bunch of other contacts. And we know contacts with close prolonged contact, that's the greatest risk for spreading the virus. So, we understand that, these restrictions, the public health messaging is restrictive to some degree, but we also have to want to try to limit our cases within Manitoba so we can kind of get back into doing some of those things that Manitobans love to do. So there's a balance there. We're asking Manitobans to do the best that they can to make sure that they adhere to public health orders and messaging as well.
From CBC Radio Canada, Matthew.
Hi, Dr. Atwal. What do you think of the situation of the First Nation, which indicate a late of vaccine for the second dose?
Yeah, so I think I saw a bit of an article on this the other day as well. From our standpoint, from our understanding, the vaccine warehouse is shipping out vaccine when the orders come in. Anything specific on the First Nation side with the vaccine rollout should probably be directed to the Manitoba First Nations Pandemic Response Coordination Team, because they are facilitating that for First Nations.
Okay, thanks. I don't have follow-up questions.
From CBC Manitoba, Bart. From CBC Manitoba, Bart.
Can you hear me right now, Doctor?
Yeah, I could hear you.
But all right, sorry, more tech issues on my part. The province sent an epidemiologist, Pip Michikamak. Normally that's an ISC thing. How can you send an epidemiologist in this instance?
It was a bit choppy there, Bart, but I think you asked, why did the province send an epidemiologist and not First Nations Inuit Health Branch or ISK? We work with partners. We have partnerships. We take care of Manitoba First Nations in Manitoba. This is public health. We have communities that need help, and we have been partnering since the beginning of the pandemic. So not only has the province, worked with regional health authorities, we've worked with the Manitoba First Nations Pandemic Response Coordination Team, we've worked with tribal councils, we work with First Nations Inuit Health Branch and ISK. We sit at tables together. We're sharing resources, especially in a time of need, to help mitigate issues for Manitobans in those communities. So if someone needs an epidemiologist, we have an epidemiologist that will be provided, that service will be provided. It's all about public health and making sure that we're doing what we can for Manitoba.
All right then. Now they've confirmed up to Michikamak rather some of the issues that they were having. What other First Nations and how many times has the province sent one of its epidemiologists to First Nations?
I don't have that level of detail. I've been involved with First Nations and dealing with outbreaks and cases within First Nations. There's partners from all jurisdictions there. I don't have a number of how many times an epidemiologist was sent. I just don't have that data.
From the Canadian Press, Steve.
I thought we had three.
Dr. Atwal, I have a question about the variants that have come up. The three confirmed cases you're reporting today, are they connected? Are they in a household? Have they had any contacts, household or otherwise, amongst themselves?
Yeah, I believe they're all separate cases. The cases aren't related to each other, so separate people traveling on separate routes. There was household contacts as well. The cases have all recovered. Obviously, some of the contacts still have to finish off their self-isolation period and are being followed up by public health in relation to testing and self-isolation as well.
Okay, and I have a question about the federal forecasts released today that talk about variants, and that says says that sorry, I'm getting a lot of noise on the phone here. The federal forecasts say that these variants could fuel a big surge up to 20,000 new cases per day nationally by mid-March if public health restrictions are relaxed further. How do you feel about the emergence of these variants, the small numbers that we've seen so far in Manitoba, the numbers we're seeing elsewhere across Canada, and what that might mean for the public health orders going forward?
Yeah, that's a great question. I have to look at the details of that modeling. I haven't looked at that. I've seen some images of it and can, answer some parts of the question there. I mean, when we're looking at a variant of concern, I think a lot of the modeling doesn't look at an isolated case that's, contained, or we're able to manage the case and contacts properly. Those VOCs, that extrapolation means that there is some community transmission of the VOCs, and that over time amplifies and becomes that exponential rise that we see in those cases. And obviously various restrictions and the behaviors of individuals within those restrictions has an impact on how cases develop, the number of interactions, etc. We know that the UK variant is more communicable. Some studies 50%, some say 70% than the normal COVID-19 strain that we have. I think in Manitoba, we're fortunate again at this point, sort of alluded to this earlier here, where we haven't seen community transmission of a variant of concern. Ours cases, have been related to travel. We've screened over 1,600 positive samples in February. We haven't found any other variants of concern or the UK variant here yet. So it puts us in a really good spot right now. Again, from a public health perspective, we're able to test individuals who want testing. We're able to screen those individuals. And then from a sequencing standpoint, we'll get an absolute yes or no if it is a variant of concern. Coupled with that, from a public health perspective, our case and contact management is aggressive with this. So we're really going after the case. We're really going after those contacts and making sure that they are self-isolating properly. So that really helps us going forward. And it also helps us couple with the vaccination program that is ramping up. In our second quarter here, we're going to be really ramping up our vaccination program, which has that impact of creating some immunity amongst the population, where even if a variant of concern at some point does come into Manitoba and sustain some growth, we're going to negate the impact of that to some degree. And the more vaccine we get in, the more federally procured vaccine we get, and we'll have a tremendous impact on this. So I think Manitoba is in a bit of a unique situation compared to other provinces, and we're going to continue to hope and work to make sure that that variant of concern doesn't take hold in Manitoba to prevent those issues from happening.
From CTV Winnipeg, Michelle.
Hi, Dr. Atwal. I'm wondering, in that same vein, what would happen hypothetically if the variant does have community transmission? Dr. Tam said today that in most provinces, the current health orders aren't enough. So would we have to take a step back on the public health orders if we do get community transmission?
It's hard to speculate here, right? Like I said, I think we're in a really good spot. I think our focus here is going to be on case and contact management, on identifying VOCs from a screening perspective, being very aggressive early on, getting that sequencing information, looking at the epi as well. I mean, obviously we have restrictive measures in place right now. We are just loosening them. We're looking to see where our cases go to, where acute care system hospitalization and ICU usage goes to decide on that next step. It's hard to speculate with unknown variables, but we do recognize that if a VOC does take hold, after a number of weeks, after a few months, basically it can become very problematic. And obviously, that can impact what we do from a public health perspective. But I think, Manitobans have done a great job. We're unique here again, where we haven't seen that transmission, which is good. And then from a public health perspective, we're going to continue to be very aggressive with that case and contact management. So, hopefully we're able to continue with that and, again, get that vaccine rolled out. So that puts Manitoba in a really good spot. Now, if things change, obviously we'd have to re-look at everything, readdress case and contact management or testing, or we might have to look at the public health measures. We might have to look at restrictions as well. But again, that's a lot of speculation for, 2 or 3 months down the road. Let's focus on today. Let's focus on Manitoba has to do today for the next week, for the next month, and take those steps. I think that's the most important thing right now.
Okay, and then on the photography regulations, where was the confusion? The press release said one thing, the public health order said another thing. How did the province find out that there was a discrepancy there? And did any photographers, I guess, unknowingly break the public health order since there was mixed messaging?
Yeah, I'm not too sure on if any photographers broke an order. I don't have that information. I think when we're creating orders, people are creating documents to interpret those orders as well. And obviously these are legal documents, and sometimes one word can make a difference as well. So a concern was brought forth to government, to public health by, I think it was more than one photographer or videographer, and we addressed that. And I think moving forward, I think the message is clear on what is allowed and what isn't allowed.
From CityNews, Jonas.
Good afternoon, Dr. Atwal. These 4 cases of variants you said have been related to travel. Is this domestic travel or international travel?
So my understanding, it's international travel.
And on that note, I guess that's the biggest source of concern right now would be international travel arriving. I mean, we do have self-isolations for folks from all across Canada right now, but I guess on that note, I guess international travel is the biggest concern right now.
If you're asking if that's the biggest concern for variants of concern, I think any sort of travel can be worrisome for a variant of concern. We do see variants of concern in other provinces where there isn't that acquisition event identified. So that means there is some of that community transmission. So we see that in Ontario. I believe there's some in BC and Alberta as well. Not to the same degree as, let's say, other countries. The UK variant, it was first identified in the UK way back, I believe, in September of 2020. It took a while for it to become the dominant strain, so anyone coming from the UK would be at greater risk. So travel is that risk. There's greater risk, I'd say, there's less risk with travel inside the province, obviously, because we don't have that community transmission. Interprovincial travel does pose some risk, but probably, I think, on a statistical basis, international travel would pose the greatest risk right now.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Atwal. Can you describe in more detail about the contact to the variant cases? How is it possible that one individual had as many as 24 close contacts? And do you think B117 has now been introduced into the community because of that?
Yeah, so, I don't have the details of the contacts. I think most of the contacts were household contacts. Obviously, the number 27 is an outlier there. I'm just not too sure on the details surrounding that. We were able to identify all the contacts. We followed them. Some of them are still in self-isolation, and we're looking at testing at all the contacts at day 10 as well to ensure that, there was no transmission to the contacts as well. So again, those public health measures are there. There isn't a risk to the community right now. I think we're managing this well from a public health perspective. These are isolated cases. There's really less than 5 cases here in total, and public health was really aggressive here on the contact side and managing that, ensuring testing does take place as well. And we have some more aggressive messaging and desires for the contacts to pursue as well. So there's some stronger measures in place there for sure.
Okay, thanks. And because of variants, other jurisdictions have changed their guidance for personal practices. So this is like the type of mask one might wear, or using a shorter time period for someone to qualify as a close contact. Has Manitoba decided against following that suit? And if not, when will we be getting updated personal guidance?
Yeah, so on the mask side, I think there's evidence there. Then we've been utilizing that evidence to support the single mask. So if you're referring to a double mask, we haven't supported that at this point. We want to look at the evidence. We continue to look at that evidence. So we aren't changing our messaging there or desires for Manitobans. I think from a case investigation, who's identified as a contact, we have with these cases looked at shorter durations of contact with cases. So it's not the 15 minutes. We've shortened that up to 10 minutes and even less depending on interactions and a whole bunch of other variables associated with it as well. And we're managing the contacts in a much more aggressive fashion with testing and also the period of self-isolation. So we've done some measures there. And we're going to continue to look at those measures, and if there's significant changes, that will be provided to the public as well.
From the Brandon Sun, Michelle.
Good afternoon, Dr. Atwal. I'm wondering if you have some additional information to share about Rivera's long-term care facility called Valley View in Brandon.
I don't know what the question is. I don't have any specific information on any care homes, but I'm not 100% sure what your question was either. Sorry.
And sorry, an outbreak was declared. I'm wondering if you have any additional information about that.
Oh, I'm sorry, I don't have any additional information about that outbreak.
My second question is, apparently there are many Saskatchewan plates riding around in Brandon. Has interprovincial travel been changed at all, or should people be staying out of Manitoba?
Well, so anyone coming into Manitoba, I mean, we do have some exceptions there in the orders perspective, you know, for people who have to go back and forth across the border that they go to regularly for housing or food, etc. Anyone coming into the province, you know, if it's non-essential or it's non-essential work to Manitoba or not for medical reasons, I mean, they are asked to self-isolate for 2 weeks' time as well. So you know, that messaging hasn't changed. So I'm not too sure if people aren't doing that. I mean, we are advising that they should be doing that and they need to do that, and that is enforceable as well.
Our final reporter this afternoon from the Russell Banner, Chantel.
Hi, Dr. Atwal. I was just wondering, with the gyms being open or the wellness facilities, what scientific data is available showing it's safe to work out or exert your body while wearing a mask?
Well, you know, there's some literature in the past about mask wearing and, you know, if and how it can impede oxygen flow or airflow. And there's been a lot of good studies saying that there's a minimal amount of impact in most individuals. Obviously, there's some underlying health condition, et cetera, that can have an impact as well. You know, masks, you know, we wear masks all the time. I think we're outside with recreational activities in the winter. We have scarves on, you know, we have masks on, and it does impede maybe some where it feels like there's a restriction there, but it's not limiting one's ability to gather oxygen, right, for your body. Again, there are some exceptions to that, you know, some people with some significant underlying health issues or what have you. But in general, masks are safe to use. They're safe to use when you exercise. You also want to make sure you're using a proper type of mask, so the material that it's made of has an impact on breathability as well. So you want to make sure it's a breathable mask. We look at cotton, and that's very breathable and that's very safe to wear.
Okay, thank you. No follow-up question.
Thank you, everyone. This concludes our media briefing.